Namaste. Welcome to Apollo Spectra Bangalore Facebook Live. As you all know, lifestyle is a very important factor which determines our health. Lifestyle disorders like diabetes, obesity, hypertension can also lead to furthermore complications such as varicose vein, which is quite common in today's youth and young adults. To know more about varicose veins and what can be done to prevent it, we have with us a very renowned interventional and vascular radiologist, Dr. Vinay Nayapathi. Dr. Vinay has been associated with Apollo Spectra from almost more than a decade. Welcome Dr. Vinay to this Facebook Live of ours. Here I would like to pass it on to you to know much more about varicose vein and what can be done to prevent it.
The most common problems in the legs we see, the vascular problems, are the varicose veins. So varicose veins is a genetically acquired disease. We see in patients, in 60 to 70% of the patients who come to me are having a genetical predominance. So what are varicose veins? Varicose veins are mostly seen in the lower limbs, that is in the legs. So what will happen is the impure blood for everyone from the foot, it has to go to the heart. When it goes to the heart, the impure blood goes into the lungs. From there it gets, the impure blood becomes the pure blood, and from there it goes into the left heart, and again it gets pumped into the system. So this is how the circulation happens. Once again the impure blood becomes pure blood and pure blood becomes impure blood, like that the circulation goes on. So here what will happen is, from the legs, the impure blood which is going up against the gravity, it goes into the heart. So while the traveling from the foot to the heart, there are two types of veins. One is the deep veins and another is the superficial veins. And these have got valves. Through the help of the valves, it goes from the foot to the heart. So when these valves become incompetent, what will happen is the impure blood, it will not go to the heart, it just comes back into the system. So this is called valvular insufficiency and or the venous insufficiency. Because of that, what will happen is impure blood fully, it won't go into the heart, it comes back into the superficial veins and will be seen as a dilated veins. These dilated veins are called varicose veins. So many of the people who think that varicose veins means they should have a dilated swollen veins. No, it's not the case with everyone, because 30 to 40% of the people only have dilated swollen veins. The rest of the people, they come to me with swollen legs, like what they call cellulitis, or sometimes they come with skin discolorations, especially below the skin. If there is blackish discolorations, it is a cause of the varicose veins. And after that, people come with ulcers. So the non-healing ulcers, especially in the legs, blackish discoloration, swelling, cellulitis, all these are causes of varicose veins. So they cause all this swelling, infections, skin discolorations and ulcers. So the skin discolorations, especially people who come with skin discolorations, they say they go to a skin doctor sometimes and they apply skin ointments and all. No. So what will happen is, these vascular problems, people who have varicose veins, since there is reflux of impure blood into the leg, what will happen is there will be skin discoloration, what we call as, in medical terms, lipodermosclerosis. Since because of this lipodermosclerosis, the impure blood which is stuck in the veins, and they cause skin pigmentation, what is called hemosiderin staining. Because of this hemosiderin staining, there will be blackish discolorations. People complain of itching. When the itching comes, what will happen? They apply ointments and all, and thinking that it is a skin problem. Actually, this is not a skin problem. It's more of a vascular problem due to varicose veins. So when they apply ointments and steroid based ointments, what will happen is the immunity of the skin at that level comes down and becomes more of a ulcerations in the skin. So that may lead to skin ulcerations also. So there are mainly two types. In one spectrum of the varicose veins, in 30 to 40% of the patients, we see swollen and enlarged veins, and the other 60 to 70% of the patients will have swellings, cellulitis, as I told you, skin discolorations and skin ulcers or the leg ulcers. So, this is basically about the introduction of varicose veins. So, later on what will happen is, many of the people who have a symptoms of varicose veins. What are the symptoms of varicose veins? Symptoms of varicose veins is when they stand from morning to evening or sit from morning to evening, what will happen is they will have pain more in the evening times, and later on they have severe cramps, itching, swelling, heaviness of the legs. All these are symptoms of varicose veins. Some people, if there are since long, if they have varicose veins since very long, what will happen is they'll have, some people complain with superficial venous, the clots, blood clots or acute thrombosis. So, the superficial venous thrombosis is a sequelae of varicose veins, and sometimes they lead to deep vein thrombosis. So, deep vein thrombosis again is because sometimes because of the superficial venous thrombosis, the thrombus gets lodged in the deep vein systems, and from the deep vein system sometimes it goes into the pulmonary artery and causes pulmonary arterial acute thrombosis. So, these are the complications sometimes patient encounter, but they are very rare, but sometimes we have seen patients having pulmonary acute thrombosis, pulmonary artery acute thrombosis. So, that is one thing. So, another thing is the complications, people who neglect, or first of all we will come to how to diagnose these varicose veins. So, once there are symptoms of these varicose veins, swollen veins or cellulitis or skin discolorations, if they have pain and symptoms something similar to what we have discussed right now, first of all a patient, that person or a patient has to first consult a vascular specialist. Once they consult a vascular specialist, first thing is they will ask for a color Doppler scanning. So, once the color Doppler scan has been advised, the patient has to undergo the color Doppler scanning in standing position. So, usually it is always better or good practice to get the vascular, especially the venous Dopplers in a standing position, because under the gravity or when the patient stands, the venous distension will be much better, and the sizes of the veins and the reflexes are better demonstrated with a color Doppler scanning when the patient is standing. So, we will get a better correct diameters, and we will also know how the sizes of the veins, are they reflecting his symptoms or not. Sometimes when they do not do it in standing position, do it in a horizontal normal sleeping position as we say, then what will happen is the sizes of the diameters of the veins and the reflex cannot be demonstrated, and so there will be a wrong diagnosis. So, although the patient has swelling visible veins, sometimes I see the reports, the radiology reports saying no veins are the normal study. So, once they do it in a standing position, we get a better picture or a correct diagnosis of the actual problem. Once the diagnosis has been made, and if there is all the symptoms and which stage the doctor, the vascular specialist, if he has seen and the stage of the disease has been identified, and the color Doppler scanning, after doing the color Doppler scanning, if there is the diameters are large and the reflexes are demonstrated and the cause of the varicose veins has been known, then depending on that the patients, they have pain and swelling and cramps, they will be advised which type of treatment can be advised. So, first thing, if their early veins are there, not many symptoms, very little pain, small visible varicose veins and not much cramps or swelling and all. So, we advise them to wear medical graded class 2 compression stockings. So, stockings are the temporary, they give a temporary relief. So, that can be worn actually below the knee. I advise all of my patients to wear below the knee, because if the calf is compressed while walking and while standing, the little bit of blood goes up to the system into the heart. So, people have actually the misconception thinking that if they wear these stockings, medical graded compression stockings, they think that varicose veins will vanish. No, they will not vanish, but then a little bit of symptoms like pain will get a relief of 20 to 25% of the pain will come down. That is about medical graded compressed stockings. And if at all the doctor says one should wear stockings, the patient should wear from morning to evening And while sleeping, since the patient sleeps in horizontal position, they can remove the stockings and sleep. I mean, again, when they get up in the morning, they should wear the stockings and continuously all through the day. So these are medical graded compression stockings. They give pressure more in the foot, and as the stockings go up to the leg, they come down. So 25 to 30 mm pressure or HG pressure, which is measured with a picometer, 25 to 30 mm pressure will be written on the labels of the stockings, of the medical graded compression stockings. One should look into those labels and take those class 2 compression stockings and wear it. That's about stockings. Now, coming to the treatment options, when the patient has even more, when the patient is wearing stockings but is still this patient pain is not coming down, or swelling is not coming down, or is having severe pain or ulcers or bleeding and blood clots and other things, more complications, then the stockings will be of no use. So we will advise them to go in for a surgery. So nowadays there is no surgeries which we are done with cut or stitch or anything with spinal anesthesia. Local anesthesia will be given to the patients, and it's a small laser operations are advised. Previously, what they used to do is vascular surgeries is a open surgery. They used to cut, stitch and give spinal anesthesia, and then the patient stay used to be long in the hospitals, and the operation time also it used to be around 3 to 4 hours for open surgeries. But nowadays, thanks to the endovascular laser treatments, in this era, venous surgeries are only endovenous laser treatments. That means a small wire of a fiber is with the guidance of the ultrasound machine. The ultrasound machine will be taken into the operation theater with the guidance of the operation, with the guidance of the ultrasound machine. A small wire will be inserted into those abnormal veins, and they will be fully ablated. This ablation takes around 20 minutes for each leg, and there is no cut or stitch. Any spinal anesthesia will not be given. Only local anesthesia will be given, and after 25 minutes of the procedure, 2 hours of bed rest is observed, and patient in the patient observation room in the post-op ward. Once that is done, patient can walk back home. So 20 minutes of walking is a must for every patient who has undergone this operation. So we encourage patients to walk at least for 20 minutes so the circulation improves. So most of the patients who come to me because of lack of knowledge about varicose veins, they come in the last stages. That means when the skin discoloration has happened, or swelling, cellulitis has happened, or ulcers have formed, bleeding ulcers have formed. In that stages, most of my 70% of my patients, they come at the last stages. So for those patients who come with ulcers, wounds and other complicated things, for them also we have to do laser operations. That time also it is only 20 minutes. But then we tell them, since there is a large wound for those patients, we tell them to wear a 4-layer bandage. So we tie that 4-layer bandage, and every week a follow-up of 2 to 3 weeks will be advised, and every week that wound will be watched, and once the healing, it takes place around 2 to 3 weeks later, patient's wound will come down, it will be totally healed and dry. Once that dryness has come, we tell them not to wear the 4-layer bandages, and we tell them to wear normal stockings and walk. So most of the patients who are having chronic diseases like swelling and skin discolorations and ulcers, they don't walk much, and they have comorbidity like knee joint pains and or back pains, and or sometimes weight because of the obesity. So because of these issues, they don't walk much. Once anybody doesn't walk much, what will happen is they increase weight, and because of the weight, joint problems, vascular problems in the legs, all these things slowly issue. So we need to walk more, we need to maintain our health, lifestyle, do regular exercises so that the leg muscles will improve. The calf muscles are most important. So because of the calf muscles only, the venous blood goes from the foot to the heart. So we advise everyone post surgery to walk good. Some people ask me whether walking helps to reduce varicose veins. No, more walking doesn't improve the varicose veins, because the more walking, the more there will be more demand to the legs. The more demand the blood supply, the more return also. Once there is more return, there will be more supply also. So once there is more supply, varicose veins also worsen actually. So in that way, walking is good for the heart, lungs and other. As a lifestyle it's good, but whatever ill health is there, that doesn't cure with walking or yogas or other things.
Thank you, sir, for this very insightful session. A few questions I would like to ask as a very layman, from a layman perspective. So could you please enlighten us as to how to self-examine varicose veins?
So basically, once the symptoms are there, suspicions, like many people who come, they say they have some bluish small spider veins, some bluish discolorations in the legs, and they won't be having any much symptoms actually. So once for those patients also, first thing is just get a one color Doppler scanning done in standing position and see the diameters, whether there is any reflux into those veins, which is an early symptom. If the color Doppler scanning is normal and the diameters are very much normal, then we need to follow it up every 6 months to 1 year, so that if they are increasing in size, because this is a varicose veins is the progressive disease. At an early stage, it may go to the second stage, third stage, fourth stage, like that. So observation is important. Any symptoms like pain or cramps should be watched out.
Thank you. Are there any emergencies that can be noticed in varicose veins?
So definitely, when there is a lot of pressure in those swollen veins, or sometimes patients complain there is a bleeding from those veins. So the bleeding happens because increased pressure, because of the reflux of impure blood back into the veins. What will happen is the veins swell. Once this swelling happens more and more, what will happen? There will be like the tire burst. It opens up and becomes a bleed. So many of the people who have varicose veins, they say that they have painless bleeding. So painless bleeding is one of the features of varicose veins. So that is one complications, and other complications, because of lack of flow within those swollen veins, what will happen is there will be blood clots. Once there is blood clot, these clots can go to the heart and cause pulmonary arterial thromboembolism. So this is a medical emergency, and these can sometimes some people come with bleedings, infections, and skin discolorations, eczema, venous eczema, we say stasis eczema. All these are because of lack of knowledge or negligence of varicose veins.
Like you were saying that a lot of patients do not have knowledge about this and they come to you at a later stage. What will happen if this condition is left untreated? What can it lead to?
So because of the lack of knowledge, many of the patients they come, as we discussed, very late. So the complications are because of that. There will be bleeding within those veins, from those veins, infections, and that can cause cellulitis, and this cellulitis sometimes can lead to non-healing venous ulcers. And these ulcers, sometimes we have seen one or two, very rarely we have seen patients having septicemia because of this lack of untreated cellulitis in the leg.
Okay, so you were also mentioning about the new laser techniques that are in place. So even after the surgery, how fast or how quicker can the patient resume normal regular activities?
So once the laser surgery has been done, that takes around 20 minutes for each leg, and it's done under a local anesthesia. So there is no cut or stitching of no cut or stitch. So we encourage the patients after 2 hours after the post surgery, we encourage the patient to walk. So literally there is no bed rest or anything for these patients. They are encouraged to walk for at least 20 minutes every day.
Okay, even if it is genetically transmitted, like you mentioned in the very beginning, what are the ways to prevent varicose veins, especially in today's lifestyle and in today's health habits that we youngsters have?
So in general, anything which is most important causes of varicose veins is, as we discussed, is the genetics, weight, the obesity, and standing jobs, continuously standing from morning to evening, sitting jobs. So, the most important thing is the calf muscle strengthening exercises should be a must. So, what yogas will help to improve the calf muscles strength, cycling, yogas, walking, swimming, all these will help in strengthening the leg muscles. So, once we strengthen the leg muscles, the chances of getting varicose veins are decreased. If genetically, if there is a chance to get varicose veins, upon that the person is having a standing jobs or a sitting jobs or obesity, all the more the chances of varicose veins is much faster or earlier. So, for those reasons, to decrease the standing jobs, like if the person is standing for long, you can sit for 15 minutes or 10 minutes, walk a bit and then do his job, or person who is sitting jobs from morning to evening, he can stand for every 15-20 minutes, walk a brisk 5-10 minutes and then come back and sit. So, such kind of balancing acts will definitely reduce the chances of varicose veins actually coming into those patients.
Thank you very much, sir. I think we have now understood what varicose veins means and how it can be prevented along with lifestyle and correct type of intervention. So, thank you so much, Dr. Vinay, for your time and for a very patient advice on varicose veins.
Thank you so much.